A heart attack. What is a heart attack? Signs and symptoms of a heart attack. What to do if you suspect someone is having a heart attack. A heart attack is when there is a blockage of blood to the heart. And when that happens, it is extremely difficult for blood to circulate around the body. Now, blood carries our oxygen. So as you can imagine, if our body doesn't receive oxygen, it can potentially become fatal. Signs and symptoms of a heart attack, the classic one as we think of is chest pain, in or around your chest. But that pain could be like a vice type grip. The pain could spread up to your jaw, your neck. It could go down your arms. It could even go into your stomach or even your back. This is what we call radiating pain. Sometimes people are vomiting, extremely sick. They could be sweating, very dizzy, not knowing where they are. If you suspect somebody's having a heart attack, you really have to act quickly. So, Edna here, I can see that she is holding her chest and she looks in a lot of discomfort. Edna, you're holding your chest. What's wrong? Have you got some pain?
I've got pain in my chest.
So she's got pain in her chest. How long's this been going on for, Edna?
Oh, about 2 hours, but it's getting worse.
It's getting worse, is it? So I can see that she is in a lot of discomfort. Edna, do you have any heart conditions that you know about?
No.
No? Okay. So I can see that Edna is in a lot of pain and I suspect that it could be a heart attack. So I'm going to help Edna. First of all, I want to get Edna onto the ground. So Edna, I'm going to help you, but I want to get you onto the ground. It'll really help ease the pain, okay? So if you can just stand up a little bit for me, and I'm going to take that chair away, okay? It's all right, I've got you. You can stand up there. That's it, grand. Well done. Okay, Edna, I'm just going to get you onto the ground, okay? This will help ease the pain. So if you just want to get down, yeah, okay, on you get. That's it, grand. Well done. Onto your bottom, please. That's it. Oh, there we are. You're absolutely fine. Okay, sit up for me. So this is what we call the W position. And this really does take the strain off the heart if we suspect that somebody is having a heart attack. So what I'm also going to do for Edna is I'm going to get a pillow. You could use a pillow, a jacket, cushion, anything that you have. It's just to keep those knees in that W position. This really does take the strain off the heart. Now, if you have aspirin, I strongly recommend that you all get a box of aspirin and keep it at home. If you are at work, however, you are only allowed to have aspirin if you have completed a full 3-day course. The aspirin must be kept in a locked away cabinet or container, or the first aiders could carry the aspirin on them. I've got aspirin in this little device here. This is called an Aspod. And when I open it up, you can see. Now, when I'm going to give aspirin to somebody for a suspected heart attack, I must ask a couple of questions. Edna, do you know if you're allergic to aspirin?
It's okay.
You're okay? You can take that. All right, lovely. The other thing that you need to do also is check the age. Now, no offense to Edna, but I can tell that she is over the age of 16. You do not want to give aspirin to anyone under this age. So Edna, what I want you to do is I want you to take this 300 milligram of aspirin and I want you to chew it for me. The reason why we want somebody to chew the aspirin is because it gets into the bloodstream a lot quicker. It absorbs through the gums, through the mouth, and it acts extremely quickly. I know it really isn't very pleasant, but you know what? You're going to feel a lot better. We don't want to give the person any water to drink for 2 reasons. The first reason being that it will actually take longer to get into the bloodstream if they drink it with water. And the other thing is that potentially someone might need an operation when they get to hospital to help. It's all right, Edna. It's okay. I'm going to call an ambulance. It's really important that you get your phone. You're going to get it and you're going to call the emergency number, which is 999. In Europe, the number is 112. The numbers are interlinked. The questions that they will ask on the phone is, what service do you require? So I require ambulance just now. They will then connect me through to the ambulance, and the first question they will ask is the casualty breathing? Yes, Edna is breathing, she is. I then want to tell them what is happening. They will ask her age. Why is that relevant, I hear you ask? Simply because the older we get, the likelihood is it could be a heart attack. Answering those questions, telling them where you're located, this is serious. An ambulance crew will get to them as quickly as possible. So when it comes to a heart attack, a few things to remember. Every 3 minutes, somebody in the UK will have a heart attack. Other thing to remember is that this will not get better. Not everybody has that classic pain in the chest. It could be quite mild feeling. They might get pain down one arm, they might get pain down two. But if you suspect a heart attack, you know what to do. Ideally, aspirin, 300 milligrams, get them to chew it into the W position. It makes it a lot easier on the heart to pump blood around the body. And of course, call emergency services. I'm Sarah, owner and trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.